Hi, it's Betsy Nicoletti. Thanks for joining me today for one of our Can I Get Paid short videos. And the question today is, can I get paid for an evaluation prior to surgery? So obviously this is a surgical question. So we know that the global surgical package includes certain work that is done preoperatively, the work intraoperatively, of course, and certain work that's done postoperatively. So it's a single payment for the global package. Is it a minor or a major procedure? Is the first question we have to ask and answer when we're thinking about the global surgical procedure. And CPT, the American Medical Association, doesn't define minor or major. These are assigned by Medicare in the physician fee schedule. And a minor procedure is considered a procedure with 0 or 10 global days assigned to it in the fee schedule. And a major procedure is a procedure that has 90 global days. And today I'm talking about, can I get paid for an E&M service before a major global procedure, a major procedure? So the Medicare fee schedule has these days listed. And so if you got opened that up, you would see 0, 10, or 90 for procedures. Sometimes the indicator will be XXX, which means the global concept doesn't apply, like for an office visit. YYY is the service is priced by the individual Medicare contractor, and they use three Z's for an add-on code to a surgical code. A major procedure includes all of the E&M services done the day of or the day before the major procedure, unless it's the visit at which the decision for surgery is made. So any procedure that has 90 global days in the Medicare fee schedule includes all of the evaluation and management services done the day of or the day before the major procedure, unless it's that visit at which the decision for surgery is made. And of course, the global period, the 90 days, starts the next day. So really, it could be a 92-day period, really, right? Not 90. So if you have a patient who comes into your office and you say, we're going to do a joint replacement, or we're going to schedule a gallbladder procedure, and those procedures have 90 global days, and you see that patient today, you bill them the E&M service and no modifier is needed because you're not going to take them to surgery today or tomorrow. So the E&M is not included as part of the of the global payment. But on the other hand, let's say you see that patient in the office as a consult in the inpatient unit or in the emergency department, and you see the patient and you say, yes, you have this condition, or your physician sees the patient and the surgeon and says, yes, you have this condition, and we're going to take you to surgery as soon as we can get an OR, this afternoon or tomorrow. It's an urgent procedure or an emergency procedure. In that case, we add modifier 57 to whatever the E&M service was. It could be critical care, could be an ED visit, an office visit, an initial hospital service, whatever that E&M service is, we add modifier 57. And we're going to use it on the visit at which the decision for surgery is made, when that surgery is going to be done today or tomorrow. It's a calendar day, not a 24-hour period. It bypasses, theoretically, hopefully, the payers following AMA and CMS rules. It bypasses the claims editing system and allows you to be paid for both the procedure and the E&M service at full fee. Now, sometimes you might get a denial. There are some, I hear from coders and billers that there are some payers that just don't pay for it. Sometimes you have to appeal it and to get it paid. I guess maybe they're hoping you won't do that. If that's happening to you regularly with a payer, I would certainly try to talk to your specialty society, state insurance commissioner. I would try to address it that way. So thank you for watching this video. Coding Intel, we have a lot of videos, some free. We have some other information that's available to members only. It's a membership service for compliance, coding, and clinical professionals who provide and bill for professional services. Our members enjoy the webinars that we do, one or two every month. We have in-depth coding guides and quick reference sheets. And I do always like to end a presentation with a picture of my dog Bowie living her best life in a most picturesque way.